In this video, we will be looking at the glenohumeral joint, otherwise known as the shoulder joint. So the shoulder joint is a ball and socket joint that's formed by the head of the humerus and the glenoid cavity of the scapula. The articular capsule, shown right here, this is a thin, loose sac, and it completely envelops the joint, and it extends from the glenoid cavity to the anatomical neck of the humerus. The inferior part of the capsule, kind of like down here, this is the weakest area of the articular capsule. The coracohumeral ligament, this is a strong, pretty broad ligament that strengthens the superior part of the articular capsule, and it extends from the choroid process of the scapula, and it goes down to the greater tubercle of the humerus. This ligament strengthens the superior part of the articular capsule, and it reinforces the anterior aspect of the capsule. The transverse humeral ligament down here, this is a narrow sheet that extends from the greater tubercle to the lesser tubercle of the humerus. So you can see that kind of sheet over here. The ligament actually functions as a retinaculum, which is a retaining band of connective tissue. So it's a retinaculum. And this actually acts to hold the long head of the biceps brachii muscle. So you see that sheet kind of just holds the head there of the muscle. The glenoid labrum is this really narrow rim of fibrocartilage around there. I'm not tracing it very well, but that narrow rim of fibrocartilage. And this goes all the way around the glenoid cavity, and this acts to slightly deepen the glenoid cavity, and it also enlarges it a bit too. Enlarges that glenoid cavity. Now you have 4 bursae that are actually associated with the shoulder joint. Remember, a bursa, singular, this is a fluid-filled sac or cavity where we see, especially where we see friction, to kind of reduce that friction at a joint. Fluid-filled cavity at the area of friction. This is area of friction in a joint. They are the subscapular bursa, the subdeltoid bursa, the subacromial bursa, and the subcoracoid bursa. So you can see one of the bursae here, the subacromial bursa. So you can kind of see it looks kind of like this weird blue sac here. Kind of circled it there. This cavity that reduces the friction at a joint. So the shoulder joint, it allows for flexion, extension, hyperextension, adduction, abduction, medial rotation, lateral rotation, and circumduction of the arm. So you're getting a lot of movement at this joint. It really has more freedom of movement than any other joint of the body. The freedom results from the looseness of the articular capsule. So it's not a very tight capsule, and also from the shallowness of the glenoid cavity. This glenoid cavity, it's not very deep, it's going to be pretty shallow, allowing for more movement there. And this glenoid cavity is pretty shallow, and this is in relation to the really large size of the head of the humerus. So when you have an example here, kind of like a really, really shallow socket with quite a large head, you're going to have a lot of movement available for you there. So even though the ligaments of the shoulder joint strengthen it to some extent, most of the strength results from the muscles around the joint, especially the rotator cuff muscles. So rotator cuff muscles, they are 4 of these muscles. First one is going to be the supraspinatus. You see that muscle right here. Secondly, we have the infraspinatus. Which isn't labeled on this diagram, but that's okay. Thirdly, we have teres minor, and which also isn't labeled on this diagram. And then lastly, we have the subscapularis. So subscapularis meaning below the scapula. Supraspinatus and infraspinatus are going to be opposite. They're going to be inferior and superior to each other. So these tendons actually anchor the humerus to the scapula. They encircle the joint, and they really kind of intimately surround the articular capsule of the joint. So we can see the articular capsule also on this diagram, or labeled on this diagram as well. The rotator cuff muscles all work together as a group to hold the head of the humerus within the glenoid cavity of the joint. So within that cavity here. And that will be what we need to know about the glenohumeral joint, the shoulder joint. So that will be the end of Chapter 9, Part 5.